In this series, we talk with physician leaders from different departments within Bay State Health to discuss what inspires and motivates them.
I think for me, pretty early on, I had an opportunity to be exposed to medicine for the first time through work in global health. At around age 15, I was traveling to South America and Central America as a medical interpreter. I'm bilingual in Spanish and English. And I would interpret for American surgeons and doctors in different countries. I actually came back to the US and brought my experience back to my youth church group. And we were able to mobilize a group of youth, young adults, and our youth group leadership to go on a second trip all together. And it actually continued on for several years after I graduated from high school. And I think it was both my first introduction to medicine, but also seeing that even with my limited experience, I could really make a difference in the lives in my own community, as well as the more global healthcare community.
When I think back over all the years, I actually go back to when I was in training. Part of residency training is working with attending surgeons in my residency in Chicago at 4 different hospitals. And I met the first woman chief of surgery of an academic surgical program in the country, Olga Jonason. When I met her, she was retired, but she would still come into the hospital. Even in retirement, she was respected by all the surgeons who were currently practicing, which wasn't a behavior that I saw from them very often. And she came in just to educate us. And I thought that that's the kind of person that I wanted to be. I wanted to be a leader. And I really aspired to be like her, to share everything that I've learned with those around me, to try to inspire others.
Well, I think it started when I completed my internal medicine training and then went to infectious diseases fellowship. This specialty really takes care of the people who, many of them are underrepresented in healthcare. And that inspired me to become a leader because I believe that I will have the more capacity or the opportunities to represent those who don't have a voice and probably solve problems differently and be able to suggest innovative solutions in order to address these inequities.